Assalamualaikum everyone, and welcome to Tabadlab's Policy Roundtable on the impact of climate change on public health in Pakistan. My name is Maheen Salim Faruqi, and I am a manager at Tabadlab. The conversation on climate change, as we all know, is nothing new. It's particularly in light of the upcoming COP29. It's been discussed to pieces in many different ways, but perhaps one aspect of the conversation that's often overlooked is the intersection of the impacts of climate change with other essential services in life, such as health, in the case of our current conversation. And the reason that this conversation is of particular importance to Pakistan, especially these days, is for two main reasons. A, because of Pakistan's vulnerability to climate change impacts, there is the potential that these impacts will further compound existing vulnerabilities in Pakistan's other services, like the healthcare system, as we've already said. And the second reason why this is an important conversation that needs to be had is because, given the current economic crisis that we're living through and the shrinking fiscal space that the government has for key services, where does that leave us in terms of how we adapt to the changing reality of the impact of climate change and the potential for it to further impact healthcare in the country? So to that end, we've put together a really great panel for you. There's a lot to unpack here. And without further ado, I'd like to start introducing the panel that we have. I'm going to go in alphabetical order. And I will start with Mr. Ali Raza Bhutta. Mr. Ali Raza is a civil servant with a long and storied career. He is currently on sabbatical, working with UNDP as a senior strategic advisor on the FCDO-funded National Governance Project. He served in many critical positions in his career, most noticeably as the Secretary to the Federal Government on Power, Petroleum, Human Rights, Science and Technology, and poverty alleviation and social safety, all of which is quite exhausting to think about. So we do welcome his expertise here. Thank you so much for being here, sir. Moving on, our next panelist today is Madiha Latif. Madiha is the country director for Pathfinder International. She's previously worked as the chief of staff for the South Asia MENA region for Pathfinder. Madiha has over a decade of experience in leading projects related to sexual and reproductive health rights and gender issues. And Madiha has also contributed to women's rights legislation and worked with the Sindh Commission on the Status of Women and other organizations in assisting ACID survivors in accessing justice. Welcome, Madiha. It's a pleasure to have you here. Moving on, our next panelist is Neha Mankani. Neha is the founder and director of the Mama Baby Fund and a project lead for the International Confederation of Midwives. Neha is a global health practitioner and midwife with extensive experience in sexual and reproductive health, maternal and neonatal health, clinical practice, programming, and midwifery advocacy. She has received many accolades, including the Heroines of Health Award by Women in Global Health in 2021 and the Woman of Courage Award from the US Embassy in 2023 for her work on emergency response midwifery in Pakistan. If I can just take a minute to say, Neha, it's a personal privilege to have you here as somebody who's been a long-term follower of the work that Mama Baby Fund does. And every Mother's Day, a bunch of women in my life receive your Mother's Day card that you put out on every year. So thank you for all the work that you do, and thank you for being here with us today. So our next panelist is Dr. Yasmin Kazi. Dr. Yasmin is a public health rock star, essentially, and she is the CEO of QZ Collective, which is a public health and sustainable development consulting agency. Dr. Yasmin has extensive experience in reproductive health and social development with over 30 years of over 30 years of experience in reproductive health and social development, and she has served as a senior country advisor for major foundations, overseeing significant grants and advancing women's healthcare initiatives in Pakistan. What makes Dr. Yasmin even more critical to our conversation today is that her work has often focused on improving medical care standards and fostering partnerships among NGOs, government, and international donors. Dr. Yasmin, I hope that we'll really be able to pick your brain on the part of the conversation where we want to get some actionable policies in terms of what we need to do going forward. Our last panelist for the day, but certainly not the least, is Sara Zaman. Sara is a feminist activist, social sector researcher, development practitioner, and adjunct university lecturer. She has held leadership positions in different women's and human rights organizations in Pakistan, including War Against Rape, Indus Resource Center, Aurat Foundation, and Shirkat Ka. Sara is an intersectional gender expert, and over the years, she has worked with organizations like the Rural Support Programs Network in Pakistan, UN Women, the Population Council, the World Bank, and the Food and Agricultural organizations, to name a few. So thank you all for being here with us today. I'd like to start the conversation by Madhya, by turning to you first in terms of helping sort of give us your insights into what the impact of climate change looks like across the region. And when we talk about the impact, I'd like you to maybe focus on just the short-term manifestations like extreme weather events, but also in terms of what you see as becoming long-term manifestations of climate change in different countries in the region. Nadia.
Sure. Thank you so much, Maheen, for having me and having us. Actually, it's quite an honor to be sitting with some of the women that I look up to and have worked with and been directly supervised by. So it's such a wonderful gathering here today. Though the topic may be a little gloomy and a bit doomy as well. So Pathfinder is an organization that actually works in 12 different countries at the moment, of which we are present very deeply in the South Asia, the Middle East, and North African regions. Within the South Asian and the MENA regions, what we have been noticing and we've been experiencing in our day-to-day operations and lives is the direct impact of climate events. Like you already mentioned, we're dealing with extreme heat, we're dealing with floods, we're dealing with droughts, which are all causing, and impacting our day-to-day lives and our day-to-day activities. But I think one of the big things that we need to start also discussing is the intersections that climate impact has on different impacts or different events that our countries are dealing with. So, for instance, if you look at the Syrian crisis and you really go deep into the Syrian crisis, one of the key linkages of that had been climate change and the uprisings that happened due to the migrations that took place. The civil unrest that does come from extreme circumstances and extreme living circumstances is something that there is anticipation of, whether we look at Egypt, whether we look at Pakistan, India. If we think about the water scarcity issues and the extreme conflicts that could come up due to resource insecurity and in if resource is insufficient due to the extreme climate events. Another key thing that is a direct manifestation of climate impacts is new and emerging diseases. Recent studies have shown increase in malaria, increase in dengue, that are all directly related to a climate event or a climate impact that our nations and our countries are suffering here in the Middle East. We're talking migration, we're talking about displacements, homelessness, which is just going to drive the already existing poverty issues that exist in the South Asia and the MENA regions. So what we're seeing is just this domino effect of climate impact, and every event and every climate disaster brings us closer and closer to being submerged in different socio-economic issues, whether we talk about conflict, whether we talk about economic recessions or poverty, and then of course overall health and well-being of everybody that is within these countries. Our infrastructure is impacted, continuity of services is impacted, and the very fact is, if we just think about heat and the average rise in temperature, one of the key things is the power grid, the impacts it will have on power and electrical supplies, which is going to be a key essential need for health facilities to continue to serve our people. So, you know, I don't think this is something that we can prevent anymore in terms of climate impact, but we definitely need to begin to piece together the different ways that climate change is manifesting in order for us to better be to be better able to respond and prepare for the future. So back to you, Mahin.
Thank you, Madhya. That was a really great way to start. So sort of moving forward from that, Dr. Yasmin, if I can turn to you and ask you to sort of narrow down this a bit for us, for Pakistan, in terms of how do you see these changes happening in Pakistan based on your career and based on like the 30 years that you worked in public health? What are some of the things that you're seeing now that you hadn't previously seen that are potentially worrying and potentially signs that we should be focusing on? Some of the things that we should be focusing on, essentially.
Thank you, Maheen, and thanks for inviting us to this interesting discussion. I hope that I'm able to say interesting things because, like Madhya was saying, that doom and gloom is huge. But of course, we have to find the pathway. That's why we are here. And that's why the advocates, the champions, and the people who are concerned about this are working, on it. So first thing I'll say, the field is very vertical. We work in a very vertical scenario. So for someone like us who works in a reproductive health, sexual reproductive health, and maternal health, so we work in our stream, and people who are working on nutrition are working in a separate stream, and people who are, who say we are environmental, kind of champions, they work in a completely different stream. So I think from a policy and pragmatic perspective, the one thing that I've been highlighting in all the discussion that we are having is to connect the dots. Nothing is linear. No impact happens in a linear fashion. So I will particularly, Madhi has very rightly pointed out the overall heat pressures and the impact that it has. Pakistan is no different. In fact, it's one of the most vulnerable country as far as climate change, although we are not participating in the carbon emission, but we are very unfortunate that impact on us is huge. And then, of course, how do we see that from a governance model and from an accountability model? That's another issue. Does our system works? They don't. Even when there is not a disaster of this level, we see that our health system are not optimal. They are not responding, and there is a huge inequity. So even the systems that are responding are very much focused on urban areas, on areas where the people have are with better wealth quintile. So it is inequitable. And then on top of that, the equity remains an issue for health and for other services. But the other one is the gender perspective. Sarah is here, so I'm sure she will shed the light on it. But like all of us, when we are working on gender, we say gender has a women face. Poverty has a woman face. Although gender is not only about women, but we know that how impacted they are because of the gender discrimination. We have seen gender-based nutrition patterns and all of that. So it becomes a very complex issue. So for me, the first policy recommendation would be to really connect the dots. So we are working in partnership with others to find the solutions. And the few things that I've seen over my number of years, starting the first crisis that I actually saw was the 2005 earthquake that happened in the northern areas, AJK and northern areas. Then, of course, 2010, 2011 floods. Then we saw COVID, which was global. And then, of course, the floods that happened last year in Sindh. Basically, I'm saying Sindh because it was hugely impacted, the Sindh as a province. And what I see in all of these, which is of course result of the climate change, even COVID, everybody says is a result of the climate change and the kind of things that we are having more viruses and we have unknown, dangers in our lives. So similarly, we have seen all of that. That the first thing that is put on the side is women health, the women sexual reproductive health and maternal health. It is put on a sideline, and we do understand that if there is an emergency that it requires survival is the first of course the first strategy that everybody would adopt. But putting it on the sideline does not help women who are in need of medical care, who are pregnant, who want contraception, who may face unsafe abortion, and all of this. And among the women, of course, the disaster impact those who are poor. So first they are poor, and then of course they don't have that kind of a power position in the households to take decisions. So they're just abiding whatever has been told to them. And the third most vulnerable part is the young woman in that household. So we have seen in COVID and in other disaster how the young girls are pushed into marriages. I mean, of course, if they are lucky to go to school, that's one lucky thing. But most of the time, they are not even going to school. But if they are, they will pull out after the disaster is gone. They'll be get married because they find that is the solution. So this emergency has an impact on the life cycle of women and girls, which is, of course, in all the communities. I'm not singling out women and girls, but I want to put it out there because we have seen during COVID, during recent flood, during last floods, that how desperate we were that we were able to reach women who are in need and provide that services, and our system totally collapsed. The public sector system collapsed, and it was only the emergency measures that were being taken. And my other message, which actually I was saying only yesterday in Islamabad, was that, why as a nation we are very reactive. We only react when a disaster happens. We know there is a monsoon coming. We know we may enter into. We don't have a proactive, planning and a strategy. So we have been talking about resilient health system. We have enough learning from the last three disasters to know how can we sustain at the whatever the level we can, optimal level, the health services, so the services are not disrupted. But we have not been able to find that solution. That's why I'm saying we need to have integration, especially listening to the communities, listening to the women itself. So you have a co-creation, you have to women-led solutions. You have to really understand what can happen. And the other thing I would
So,
say, the
Dr.
private
Yasmin,
sector.
sorry. Sorry, I'd really love to circle back to this point in a bit, but for now, I'm just going to ask you it because you spoke a lot. You've spoken at length about. There's a number of things to unpack here, and I'm going to revisit some of them going forward. But I'd like to start with the gender dimension that you mentioned. And for that, what I'd ideally like is I'd like both Neha and Sarah to weigh in on it. Neha, I'd like to start with you because when we talk about vulnerable communities, it doesn't get more vulnerable than the kind of communities that you work in, right? So, in particular, what I'd like you to talk a little bit about some of the things that you've seen. Again, not, and this is I can't stress this enough because I feel like this is building that sort of long-term picture is really important about how things are changing in the long run. So it's not just about the fact that the flood came and there was a short-term impact that happened, but I know that there's a research study that Al Khan University is doing about how heat waves are affecting pregnant women, for example. So what I'd really like is for you to just sort of give your insights on some of the things that you've experienced, some of the things that you feel have changed in the time that you've been working in these areas, and some of the things that perhaps are overlooked largely. And then after that, Sarah, I'd like you to weigh in on some of the things that you have also experienced in your time working with women, and perhaps like if Neha can give me a perspective based on her work in the particular areas that she works in, and you can give me a sense of, sort of a broader sense of how the whole gender question is approached out of this, that would be, I think, great. So Neha, we can start with you, and then we'll move on to Sarah next.
Okay. Thank you, Maheen. So, sorry. So, I think this is really interesting because I feel like when we talk about, I know in a lot of context when we talk about maternal health, we talk about extreme weather events like floods and climate disasters, but climate change itself is doing a lot of things as we've seen. So the community that I work in, primarily provide care. So I do a lot of emergency response work as well, but where I primarily provide care is a coastal communities off of Karachi. So this is a set of islands, and they're around 15 minutes away. And this community has been, so we provide, so Mount Baby Fund is the only care provider to around a community of around 40 to 50,000 people. And this community is heavily climate affected. So they're climate affected because it is, when you're living in the center of the sea, it is a lot more hot and humid, but also it's a community that has been traditionally dependent on fishing. So it's fisher folk, and they are also seeing a lot of, because of environmental degradation and climate change, they're seeing a lot of loss, like things like, the water levels the water temperature is warming up so much that they're losing fish. The environmental degradation means that they don't have any catch. The rising sea levels means that their homes are being destroyed, and we're seeing a lot of impacts of that. So the first thing I talk about is heat, because this is something that I feel like every year I'm starting to see more and more of it. And there was a time, and now that I've been doing clinical work for around 10 years, I feel like I can actually see the changes that are happening in maternal health on ground. So this year, for example, we have had it. This summer was very hot. It was hotter than all the summers that we've seen before in our lives, and we saw a direct impact on maternal health outcomes. And I know that we're still coming up with information, with evidence that kind of proves this, but I think we've seen it so much anecdotally that we almost know it to be true. So this year, we've had so many women who have had just mid pregnancy losses, unexplained completely. They've had early pregnancy losses. We're seeing a lot more than anything I've ever seen before. Increase in hypertensive women, so women who have pregnancy-induced hypertension, gestational diabetes. Women who are experiencing heat stress, then also babies who are, so that we've had a summer where we've had a few weeks where women received everything that they needed during the antenatal period, but when the babies were born, a lot of them had respiratory issues and needed neonatal intensive care. So these are new patterns that we're seeing. There's things like women going into preterm labor at 26 weeks is not something that we would see for no reason. But whenever I always try to get deeper into what was the living situation or what they were experiencing, and a lot of times what they'll say is that obviously all of them live on these islands, but they don't have electricity, they don't have cooling mechanisms, and pregnant women cannot regulate heat the way that everyone else can. We have babies coming in who have fever because they're just burning up because they can't regulate their body temperature either. So we're seeing these direct things. But then I also, in a climate affected community like Baba Island, we're also seeing things like, as Madiha mentioned, lots of vector-borne diseases, lots and lots of skin issues, which again affect pregnant women very differently, but also lots of indirect effects that, malnutrition and food insecurity. So where there's no food, a lot of times, as Dr. Yasmin mentioned, the woman will be the first to be affected by this. Women and children will be affected first, but also things like mental health. So the mental health impacts of not having enough food, losing pregnancies, that also all comes together. And we see this thing. So in the summer, when the monsoons are just getting worse and worse, the monsoon season, so a lot of times this community is not able to get any food in the summer. So in that summer, we also see a really dramatic rise in domestic violence, because it's a small community, so you can see all of these things quite directly. And heat and climate, I just think, affects women so unequally. Even small things like, men are just able to, if you're on an island, you would think that you're surrounded by water. Men can cool down a lot more easily. You'll see boys and men just jump into the water when it's hot. Women are not doing that. They're not even allowed to cool down in those ways. So even small ways, they're just affected so differently by heat and climate than just the way that, women dress. They just are affected very differently than men in all ways. And that includes even in flood situations. Things like women, when there's a displacement camp of 3,000 people, women are much more affected when there's only one toilet for 500 people, because they cannot use anything else. So we see a lot of different impacts, and we can unpack some of them more. But in pregnant women, I think it's been really clear what is happening.
Thank you, Neha. Sarah, can you please continue from there? Sarah, I think your mic is muted.
Yes, it was muted. Sorry about that. Thank you so much for all those comments. And I think that this is just straight off the bat, this is such a complex issue that it gets very difficult to sort of unravel the different effects that this is having on people. And again, Neha has spoken about the coastal communities. She's talked about heat issues, and Madiha also mentioned about floodings a little bit. But I think that when we talk about the impact of these changes on not just women, but what was called vulnerable communities, I think vulnerability again is such a broad concept. There's a lot of things that make people vulnerable to different things. Just as a matter of looking at data, we do look at the age of the person. Like, for instance, I know that there's this global study that says that children are sort of bearing the brunt of climate change massively, maybe even more than women, right? So vulnerability comes with your age, it comes with your location, it comes with your gender, and a whole host of things. Of course, your socioeconomic status and all of those things. The one point that I want to emphasize is that if you want to look at the impact and if you want to look at solutions, right, we tend to have a lot of answers, but solutions are sort of more scarce. We need to really see who we're talking about. um, there are different impacts, as people in this room probably already know, and it's not just about heat that is taking its toll in urban areas, in coastal areas, in rural areas. When you look at the rural setting, if you leave the coastal areas, which is, I believe, some 300 kilometers of Pakistan's is the coastal area which we have. So we are talking about a huge land mass in which people are settled, and it runs across provinces, right? But there's also the issue of desertification. There's the issue of droughts. There's the issue of infestation in agriculture. Women face a lot of heat when they are working, especially in wheat harvesting. There's a lot of manual labor that they do, and they suffer a lot of heat. And they, of course, have no shelter. They have no safe water, or access to safe sanitation. There are also issues of people who live in the riverine areas compared to the coastal areas, where flooding is quite common, and people tend to migrate multiple times in a year because of seasonal flooding and because of changing not just climate patterns, but seasonality and all of those things. With that comes the issue of out migration of people, not just affecting people but also livestock. And then we know that women predominantly in our society and generally in South Asia have a huge burden of water collection, right? Not just collection, but also, bringing it to their homes. It is impacting coastal communities in the sense that islands are getting, far away from each other. And then in rural communities, in the agriculture sector, you see that, water is not, underground water is not being recharged. So women are having to walk further away, which of course exposes them more to heat and also to all kinds of violence and things of that nature. And then, when we talk about uh, sustainable cities and livable cities, again, there's so much urban mismanagement in terms of rainwater, what we do with it. We've had so many multiple urban floodings in recent years. And then that is coupled with, demolition drives, and housing is a huge issue. And it's not just the case for people living in riverine areas, let's say in the Kacha areas across Pakistan, but also in urban slums. So I think it's, when you look at these different ecologies, you will see different impacts, and you will see that people are coping with these impacts differently, which is affecting different sectors. I mean, it's not just about health and population welfare. You've got the labor department, which is concerned with this because of people's changing livelihood preferences. What land was, say, productive at one time, that land use is changing. People are migrating. They're looking at different kinds of work as they're adapting or whatever, just changing their preferred way of, or whatever is more feasible for them to earn a livelihood. You've got a sector that's dealing with youth issues. You've got industry, chambers of commerce, you've got agriculture, livestock, fisheries, forest, and energy, and all of these different departments. And I want to come back to the point that Dr. Yasmin was making about, policy, and of course, policy very tightly close to politics, and us being reactive and not being proactive, and disruptions being there. And it really makes me think about, can the way that our government is and the way that it functions, and you've got these cycles of, disruptions that keep happening, is the government bureaucracy, for instance, in particular, can it even deliver? because of the frequent changes within democracy, within the climate, where it is easy to pass a policy and keep renewing it, 2 to 3 years, but it takes forever to actually get things off the ground. And then you've got people that are completely disconnected with these policy decisions, right? With what needs to happen where. I can quote so many examples of, say, the Sindh government doing these little pilot projects to, promote resilience, to promote adaptation and things like that. But I see no cohesion across different sectors that are directly concerned with this issue. They're not part of the conversation. Women are certainly not part of the conversation. It is happening at a lower level, even though it has been shown across different researches that when women are put in charge of these kind of issues, especially resource utilization and how you use your productive resources, things do improve for the overall household. They do tend to spend more on health, more on education, but not happening. And then the things that should have devolved down to the lower level have not evolved. So it's basically, you have the laws, you have the policies, which are progressive, but not backed by systems, and definitely not backed by representation or any hard evidence which shows that one particular action is going to work and who is it going to work for. So I'll stop here.
So, yeah, thank you, Sarah. That's a really good place to stop, because this kind of naturally helps me segue to Mr. Ali Raza, who I will put in the difficult position of putting on his government servant hat right now. And so we've had a number of problems outlined here. Ali Saab, we've had, we've talked about the long-term impacts of heat waves on pregnant women. We've had that conversation about how the very nature of disease is changing. This is a conversation that's being had globally as well. I read an article on BBC the other day which called it a crisis of emerging infectious diseases with known pathogens sort of evolving to new things. And perhaps on one level, COVID was an example of, some of the things that we can expect going forward. So I suppose what I'd really like to do with you is to revert to one of my favorite muhavras in Urdu, is to get a sense from you about, at the government level, is there a recognition of the fact that hum kitne pani mein hai, effectively? Okay, is there a recognition there of the gravity of the problem? Is there a recognition of what the scale of the things that we deal with are, and the immediacy with which these need to be addressed?
Thank you, Maheen. Very well framed question as far as policy is concerned. No, it is not difficult for me at all to wear my government hat, because that's a hat I never take off. I would like to pick up from the point that Dr. Kazi mentioned, and then Sarah reinforced. The way that the health sector in Pakistan is vertically, as Dr. Kazi put it, is vertically designed. The way the non-optimality of the system and the inequity in the system, the way that affects the outcomes and the working of the system as a whole. You see, you're all much more competent than I am in terms of determining the linkages between the climate change and impacts on health. My view in government, with my experience in government, has been that there is so much segmentation and fragmentation of government and health responses and climate change responses, generally even outside health, have to be more coordinated and have to be designed such that the whole of the government and the civil society, unless they work together, optimal results cannot be achieved. And the fragmentation, an example of fragmentation is that even within the government, there is the federal government, and in the federal government, the Ministry of National Health Services, and then there is the Ministry of Climate Change, but who are responsible for for designing coordinated policies. But the action is entirely at the provincial levels. And even at the provincial levels, the health departments, the way they are structured, as Dr. Kazi said, the non-optimality, it is so obvious in the design, and that has political reasons, that has bureaucratic reasons. But the fact of the matter is that provincial governments who are responsible for health responses, if the government of Punjab is allocating 15% of its budget for health, and government of Sindh is allocating close to 12%, and that is the range that all the provincial governments are allocating resources for health. Within that budget, for the government of Punjab, the public health uh, programs are only getting about 8%. Uh, Within the government of Sindh budget, the public health responses are only getting about 5%. And that includes anti-malaria, anti-tuberculosis, nutrition, mother and child health, anything that has to do with public health. So even without having to confront the issues of climate change, uh, the the systems are not equipped to respond to the existing vulnerabilities, responding to the vulnerable women and children's needs. Uh, all of us know the nutrition status in the country, where 37% of the children are stunted, or close to 20% are in wasting. Uh, and the tragedy then with the climate change is that the areas most vulnerable to climate change are also the areas where stunting, wasting, deficiencies in nutrient deficiencies in women, infant mortality, maternal mortality are the highest. Southern Punjab districts, uh, Sindh districts, Southern KP, all of Balochistan. Now, with climate change impacts, the vulnerabilities are going to be compounded. So the question of this dialogue is that whether the systems can adapt. First, the systems have to improve for the current situations, and then the question of adaptability will come in. That is, of course, they can adapt, and for that, a number of other things will have to be done in our national adaptation plan. The first point is that a joined up approach has to be adopted, and the Federal Ministry of Health has to coordinate for that. And then we have to have data, we have to have information so that we can monitor those responses. But even that work has not started yet. Uh, there is some, and now coming finally to your question, whether there is a realization in the government, yes, there is. There is a strong realization that the way we work has to be improved, and for that, the structures and the capacities of institutions have to be improved, not just in health and not just in climate change, all around, but particularly in areas which are in the domain of the provincial governments, where the federal government, the civil society, the provincial governments all have to come together and then work to for that agility and adaptability. I'll stop here.
Thank you, sir. That was tremendously useful. And some of the things that you mentioned about the need for capacity and capability to improve, I'll circle back to those at the end when we talk about specific recommendations. For now, if I can go to Dr. Yasmin. Dr. Yasmin, you have spoken a lot about the fact that we work in silos, and we've had this conversation at the policy level quite a bit. I was wondering if you can give me some insight into a slightly more granular view of healthcare in Pakistan, and give me a sense of the fact that do hospitals have a recognition of the fact that the dynamics of what they deal with are changing? And by this I mean both public and private sector hospitals, right? Is there an understanding there that little things like, for example, dengue will last a lot longer. The time frame for dengue, for example, is lasting a lot longer. Malaria is spreading in different ways. Are hospitals recognizing those patterns, and is there a need to react to those at that level, perhaps?
Yeah, so dengue and malaria are something that, if the health ministry takes an action, then the public sector hospitals would react to it. So they are very much bound to the public policy. The private sector, of course, would look at more from the larger lens of, who would be coming and how this could be served. So they have their business model, and they will definitely adopt much more quickly and much in many ways. I don't want to discredit the public services, but in a much better way, because they have that resources and they may have better expertise. So yes, there are, so there is a lot of variation. There's nothing is standards. If you can say, are these the standards that a public policy is talking to, and who it is talking to? Because uh, repeatedly we have been told that Pakistanis, the communities, whether they are poor or whether they're really poor, but they would revert to a private sector when there is an emergency or a healthcare crisis. So if the private sector is the one that people are going to, and they will be just ending up in public hospitals for other things, or maybe when they are not able to cope with the private sector expenses. So then, you have to have a very equitable kind of a standards and things that are important from responding to any crisis that is happening. It is because of the climate change or anything else. One of the good example that we can quote, and I have quoted it several times, is COVID. Because the COVID had the worst nightmare for us as Pakistani, because we saw that how the Western world and how the most modern world, which has the strongest healthcare, totally collapsed. The number of deaths and the kind of fear it created globally, and we were just frightened because of the overpopulation. Like 12 people, 15 people living in a small household. What will happen if it hits Pakistan the way it has hit the rest of the world, even in the region? But in the COVID, we saw that how the government, the chief minister, the prime minister, is sitting at the task force, and all the groups, even the our agencies came together, and everybody joined the private sector played a huge role, and they came on the board, and it was a very joint framework that everybody adopted, and everybody came on board. And when they started planning collectively the kind of behavior change, kind of the demand creation for vaccine, but how to make sure that they have, they were able to do it, and then creating the COVID board, responding to it. So and everybody was surprised, the world was surprised, that how come we had such a low caseload and such a low mortality rate compared to even the countries which is next to us, like we saw in India and Bangladesh. So I think that was a classic example that when you have a political commitment, so one thing is the political commitment. You have to have your political leadership and your bureaucratic, of course, leadership to come on one page. Then you ask private sector to join you because of their expertise, their niche, and their outreach. And then you have communities sitting there. Then you have champions sitting there. Then you have other who can track the data, the real time monitoring, responding as it's happening. So I think it's not that we don't have the ability to do that. Do we have the will to do it? So I think that's the major kind of job. ने पूछा था ना कितने पानी में, हम इतने ही पानी में जब हम पे कोई चीज करनी होती है हम कर गुजरते हैं. And we also show it surprise the world, but that only happens once in, I think, century or whatever. I don't want to say that, but what I'm saying, even for dengue, we have seen of course, it was more provincial successes what we saw, but when we saw it happen from the top, and there was an accountability, there was a governance, and there was a check on it, we saw the results. So I think if we want to really create that, sensitivity and the kind of awareness around our healthcare system, about among providers, that this is happening, the dengue will repeat, this thing will happen, malaria is happening, how can we be better equipped? sensitize the communities. Of course, it's because it's not always the supply side. I mean, it's not always the curative side. You have to look at the end of the value chain. If they are not aware of when to come, where to see, how to get themselves checked, and how can they prevent it? Because it's a public health issue. So everything is preventable. So the thing is that you can prevent it if you are creating that kind of public health awareness. But the thing is that for that you have to join forces. You have to come together, and then you can measure the outcome. So yes, in response to your question, we have seen changes, but it's not uniform, and it's not everywhere, and it's not the way it should be, especially when you go to the last mile. Our biggest tragedy in healthcare in Pakistan, we fail when we go to the last mile, because you can see a lot happening in the center, but go to the last mile and you will see all the healthcare facilities disappearing, BHUs disappearing, no providers, and of course, then quacks take the space there, because when you leave the space, then somebody will take it, and they take that
Yeah.
space, and then you are seeing all the conventional, which is okay, at least someone is there to talk to them, the conventional people walking in. So I think for us, the going to the last mile is a basic, like a gin, for us to first resolve, and then we can see our health system delivering, because these are the one who we are not reaching to. The last mile, vulnerable communities are going to suffer most because of the climate change, because of the disaster that's happening, because of anything that's
Okay.
happening related to healthcare. So I think that
Mhm.
should be one way to look at it. I'll stop here.
Okay. Thank you so much for that, Dr. Yasmin. So, um, Neha, if I can go to you in terms of the point that Dr. Yasmin raised about the need to sensitize the communities. I was wondering what your experience has been in terms of how communities feel about the changes that they're experiencing. Is there already that awareness that exists within them? Is that something that at the very basic level they have, because they obviously know their region and their own life better than anybody else, right? So to what extent are they aware of what's happening and what the reasons behind it are, and to what extent does it need to come from outside to bring them to that level where they're able to adapt to what is coming for them?
Thank you. So there are a couple of things here. So first, I'd like to just build upon what Dr. Kazi said about just having that information even at the healthcare level. So this is something that I talk about a lot in my work with midwives, that all the climate discussions we have are kind of over here, but midwives, community health workers, community members are all functioning at the grassroots level. And knowledge equity is just a really important thing. So we have all of this evidence, but what are we doing with the evidence? So until the evidence is actually translated to at least healthcare providers who work with women every day, that knowledge, I think, is kind of useless, because the people who actually need that information need to get it. And we're doing a lot of work around that. I know that the organization that I work for, the International Confederation of Midwives, what we're trying to do is get a lot of this climate, all the evidence that we're seeing, get it put into pre-service work. So midwifery schools, midwifery education, healthcare providers should know this right from the get-go, what that connection is, because it's a complicated connection that not everyone will understand. But then there's also the other part that you just mentioned, which is community knowledge and understanding. So I know that not everyone will know this. There's a lot of work that we do at the community where we talk to women. This year, I've been, because we've had so many cases within the community, I've been talking to women directly and sharing case studies about the impact of heat, the impact of climate, the impact of environmental degradation, and what's directly happening. But there is a lot of community understanding. Maybe without as much nuance, but understanding on what's happening. Because the other day I had this woman come over to me. She's a traditional birth attendant, and she had come from another island. And she had actually come to me to report that there was a loss in her community. She said, I was called to a delivery, and this woman was 24 weeks pregnant, and she went into preterm labor, and there was nothing I could have done at that moment. But she told me, she said, this is happening because of the heat. She said, I've seen that. In my lifetime, she said, I've seen the heat change so much, and with that I'm seeing the changes that are happening to women's health. So she herself highlighted, she said, I can see these connections, they're happening because of the heat. So what the community, I think, in so many ways already knows what's happening. They see those changes. It's just that we there's disconnect between what we know as evidence, what there is community knowledge about, and bringing both of that together. And I think also closely related is this thing about when we do awareness raising, we talk to communities. There's all of this. Often there'll be. I mean, I know that a lot of people will come to Baba Island and they want to talk to communities about environmental degradation, for example, or about preserving the mangroves, about not throwing trash, that kind of thing. And what I'll always tell them is that yes, the community is definitely responsible. They need to be responsible for their own environment, but there's also just so much that you can do when you don't have any infrastructure. So women will tell me that there's pregnant women who will, in full term pregnancy, they'll be like neck deep in the mangroves, in mulch, cutting the mangroves for firewood to cook, because they said we haven't had gas for a year now. So we don't have any choice but to cut the jungles, even though we know that we should not cut them because we know what they're doing to us. So there's just, it's so problematic to hold the community directly responsible for what is happening to them when we are not giving them the infrastructure that they need to just to survive. So that's just some of what my thoughts are on this.
Thank you, Neha. I think that this is a great point that you made. We seem to have lost Madiha, but I'll use that time to, Sarah, jump to you and talk a little bit, ask you to talk a little bit about what Neha just said about local knowledge and local community awareness. And I'd just like to ask you to talk a little bit about how can we harness all of that local knowledge to sort of build that sort of collective response mechanism that we're talking about. How do we do that? How do we build that connection? How do we connect those dots, as Dr. Yasmin put it?
Right, thank you. I think what Neha has said is extremely important. And I completely agree with the idea that it's very problematic to say that, people don't know. People do know, and they do realize, maybe if not fully, they do understand that there's a change on the way. And it's backed by scientific evidence. I mean, I believe Pakistan is well above, the representative concentration pathway that you have for heat. So where I think where the global is like 3.7, we're 5 point something. So definitely heat is increasing and people are feeling it. But coming back to your question on people's involvement in solving the problems that affect them. Yes, Dr. Yasmin is absolutely right. COVID was a very, very good example of seeing different actors, kind of come together after we were shell shocked for a good, 8-9 months when the entire country shut down. And one of the things that I at least was trying to do, working with the health ministry, was to get those, kind of local platforms together and active, because I'm connected with various activists in different cities in Pakistan. I knew for a fact that, and I know still it for a fact that activists generally tend to be more agile and respond to crises, right? So there were so many people within the community that organized and they were trying to help the government, and eventually the government did take them on board to sort of identify who were the people who are employed in informal sector, have lost their jobs because of COVID, and the same kind of stuff the government also tried to do with the 2022 floods. Although we keep learning this lesson again and again across calamities, whether it was the earthquakes in 2004, the floods of 2010 and 11, or in 2022, we keep learning that the people who are locally placed are the first responders, because usually in the peripheries, as Dr. Yasmin said, government services thin out, right? So they're the ones on the spot. They know who was more affected. For one thing, that we picked up on during research during the floods in 2022 was that people knew exactly where people with persons with disabilities were, or the pregnant women were. The government had no clue, right? Because a lot of these surveys that happen, it's cyclic, and they don't update information that quickly, and then they're just simply not that agile, government systems. So you've got these platforms at the local level where people are active, and there are so many different civil society organizations that are trying to make linkages between climate change and health. You may agree with their approach, may not agree with their approach, and there are, of course, other confounding issues as well that they're not tackling. But I think, as our friend Kesar Bengali likes to say, that the time for 18 Amendment Plus came a long time ago, to sort of try and devolve these provincial systems down to the district level. And what we're seeing in Sindh is just to go back to the example of the floods in 2022. The World Bank report shows, a recent one, and on that they've built a project actually, is that 1/3 of dispensaries in Sindh were washed away by the floods. Right now, BHUs are more remote than dispensaries. Dispensaries usually tend to be 2 to 4 kilometers away, whereas BHU can be anywhere between 15 and 25 kilometers away. 1/3 of them were washed away. Right? So where you need health systems to be resilient, they're the first ones to be hit by, events that happen, especially flooding. And we are very vulnerable to flooding, heat and flooding, two things that we're affected by, mainly in Pakistan. Drought, I think, is secondary and is kind of more located. So I think that there are so many platforms available. There are people who are activated. They are working at the local level, and the government really, I mean, the time for vertical programs is over. We've learned that from the Lady Health Workers program. We've seen what happened to them in recent years, especially. अब उनके ऊपर पता नहीं कोई 20-22 responsibilities लाद दी गई हैं, तो वो बेचारियां ये भी करें वो भी करें. मुझे समझ नहीं आता कि how these decisions are made. And then there are some people who've been working, giving these kind of services. I'm sorry, let me interrupt here. One thing I really want to emphasize, and I wanted to say it earlier, is that reproductive health, the good things that we have achieved in reproductive health, may be on some part because of facility upgradation, but a lot of it has turned around because of community-based health systems, which includes your lady health workers, which includes so many other cadres that that basically rose from the community itself. उनकी बाद में रेगुलराइजेशन हो गई और वो भी गवर्नमेंट सरकारी वो बन गए, वो एक अलग डिबेट है. लेकिन those are the things that have kind of turned things around in Pakistan. Lady Health Workers program को globally quote किया जाता है as a fantastic example of getting services, outreach program और ये सारी चीजें to the people where they are. अब आपके यहाँ पे BHUs जो हैं वो PPHI is the one that's kind of handling BHUs and also dispensaries, but they're not working. I'm sorry, in outreach and preventive care वो नहीं कर रहे हैं, and promotive care वो उतना नहीं कर रहे हैं जितना वो कर सकते हैं. लेकिन वो कौन वो space fill कर रहा है? Community based workers. So again, just to end it here, you need to find solutions where the problems actually are, as opposed to sitting somewhere else and imagining कि ये कर देंगे, वो कर देंगे, जो भी हवा चली है, उसके हिसाब से, and then it'll work. I'll stop here.
Thank you, Sarah. Madhya, welcome back. Sorry we lost you there for a couple of minutes. I'd like to come to you now, and a little counterintuitively to what Sarah was saying, but I'm hoping that it'll link together. I understand the need to focus at the community level and learn from the community level, but to an extent, the impetus for some of these things in terms of building a system from which covers all types of organizations, the government, the private sector, has to come from somewhere above as well, right? So what I want to understand from you is what is the role that the COP29, for example, plays in all of this, and is there a role that things like the loss and damage fund or general climate finance have to play in terms of helping connect these dots and sort of learning from the community, but also being managed in a more sort of global and holistic way, so that there's an understanding that we're all kind of working towards the same end goal.
Thanks, Maheen. And, a lot has been said and a lot has been put on the table. When Neha talked about community knowledge and knowledge equity, I just wanted to, emphasize that was something that we learned as well while we were working in communities with her Parker. It was Sarah's research that drove us to go into the communities and work with community knowledge, indigenous knowledge, and build and co-create with the community solutions for climate impact. But one of the things that I think we need to keep coming back to is when we talk about the health systems and we talk about the health infrastructure not being available, that has to come from health financing and increasing the investment in our healthcare systems. One of the big things that we've noticed across the years, and I don't mean just us, I mean generally, one of the big comments that keep coming back when we talk about budgets and budgetary allocations is that our health systems continue to be budgeted. Budgets allocations for the health continue to be in minimal in comparison to what is needed. And if you look at global statistics, if you look at the global evidence, one of the things that is constantly underscored is that if the health sector or the health systems were a country of its own, the health sector would be the fifth largest polluter and the fifth largest contributor to greenhouse gas emissions, which signifies that the health systems is not just about the infrastructure and the equipment and all, but also their own policies, their own procedures and operations and SOPs that are contributing to the issues at hand. And that is exacerbating adaptability and vulnerabilities in the communities that they exist in. The fact that Sarah brought up that so many of our dispensaries were washed away, I'm not sure, and I can't say this for sure, but I don't see at the moment, working in the health sector, that we've had plans in place to replace or to rebuild. We are definitely working towards investments in converting our health facilities to become more green, but they're not coming with a strategic plan or a strategic framework, but rather being done based on just little bits of needs that we're identifying. For instance, when we talk about electricity, so we're using solar panels, but we're not talking about how we're managing our waste, where we're dumping our waste, how it's affecting the communities that are around us, and how does it exacerbate the already existing health conditions and the poor health conditions around these areas. So when we think about COP29 and big global platforms like that, it's sad to say, but a lot of these negotiations have already happened beforehand. So, bringing in community knowledge or bringing in knowledge from the ground, that really has not been cultivated. It's not been a space that's been cultivated at the COP29. We have these high level decision makers over there. We know that negotiations and deliberations take place, but CSOs, community activists, researchers, they don't really have a seat at the table, and that's where it comes down to representation and the need for representation as well. So it's hard to say that COP29 or these big high level conferences may result in some changes that we need, but I feel like that's also something that's a long term plan, or like even with the loss and damage fund, or whether we talk about climate financing, or even just knowledge sharing in terms of climate tech, and how we can share that knowledge with countries, between countries, cross border regional collaborations. All of that is the need of the hour, yes, absolutely. But I think if we want to look a little more inward and want to have more immediate results or immediate changes, I think there are a few things that have already been discussed, which include the local governance involvement, local governance ownership, but also critically is how we're investing resources into our health systems, and with what plans are we investing into our resource systems. We know there's a dearth of human resource for health. What are we doing about that? We know that there is issues with infrastructure, with research and equipment and medical know-hows. We know those capacities, those capabilities, equipments, medical, medical instruments, that they all need upgradation and they all need to be brought into newer centuries. And I know that this is happening in small pockets. It's just not across the board, and it's just not. It's also just not enough, based on the population needs and the population growth that we're experiencing. And then at the end of it all, I think it is really important to come back to this, is that we need to be investing better for women's health, particularly when we talk about reproductive health. That investment is critical. That investment is a very critical need of the hour for our health systems to be able to be able to be resilient, for the future, for future events as well. So I'll stop there.
Thank you so much, Madiha. So, just jumping from that to Ali Raza Sahab. So, what I'd like to ask you, I believe it was you who mentioned, or at some point somebody mentioned the need for intersectoral collaboration. So, what I'm hearing from everybody is that there is a collaboration, there is a need for horizontal collaboration and vertical collaboration, right? And sort of a learning across like the whole sphere of or the ecosystem of public health and climate. So how do we go about doing that? For example, like how, because you also said earlier that there is an understanding in government circles about what we're actively facing. So where does the, my question I suppose is, where does the impetus come from? Like how do we begin to build those networks? How do we begin to build that collaboration that we need to address these issues across the entire spectrum?
One of the ways is that if a crisis happens, as Dr. Kazi said during COVID, then NCOC emerged and it brought about the entire government machinery and the non-government actors into that. But what is needed is much more than that. What is needed is a sustained structure and capacity, particularly at the provincial government level, where all the stakeholders work together. And to do that, I would like to make 2 points. I think, and both are related to agility of the systems and our capacity to adapt. The first one is about the information systems. We The information systems in this country have developed as all over the world, but amongst the developing countries, Pakistan is a good example. We have a very good information system, a database, a national database with NADRA. We have a very strong socio-economic registry with BASP/SAS. And that is a dynamic. Both are dynamic databases with people being added and their status and attributes being changed. I think what needs to be done at the provincial level is uh, to work with these two entities and add a robust health management information system so that we know, rather than just relying on a survey here and a survey there, we have more granular information available, and that will add to the agility of the system and will also result in more joining up of the systems. And secondly, I think for the that agility to be improved, it is critical that we devolve. As Sarah mentioned, this is something that the governments tried to do in the early 2000s, but for a number of reasons, that initiative fizzled. Uh, it is mind-boggling how anybody can hope to have a, a robust system of tens of thousands of health facilities over areas as large as our provinces. It's not just districts. I think that it has to go down even below the district to the tehsil level, but at least at the district level, where the communities should have can have their voice in the running of those systems. And if we can do that, that joining together of forces of the district administration, of the disaster management authority, of the health systems, of school systems who have to provide in times of crisis their buildings. There are so many actors, and they're getting together at the district level, which will be much less complex and easier. There will be more agility will be added to the system, and then the provincial governments and the federal government can provide the resources or can provide the policy direction. But the devolution in the health, also in education, but especially in health, to the district level is critical, in addition to building good data systems.
So we've had a wealth of information that's come out in this, and I'd like to just sort of wrap up now by asking. I know that there have been multiple things that have been said, but I'd like each of you to take a minute, maybe two each, and just give me 2 or 3 concrete policy recommendations for what we need to do going forward, both in the short term and in the long run, but ideally not longer than perhaps a minute or 2 minutes. So what we can do is we can start with Madiha, and then Dr. Yasmin, and then Neha, and then Ali Raza Sahab, and then Sarah, we can conclude with you. So Madiha?
Sure. Thank you, Maheen. I think, just reflecting on everything that's been discussed today and everything that we know from the field, from the ground, and from global and so on, is the need to understand climate and climate change and climate impact as an intersectional issue. It is not one that is without direct impact on the other sectors that we have working in, and to establish multi-sectoral coordination mechanisms in order for us to prepare policies, prepare programs, interventions, and resource allocation accordingly. And I cannot begin to emphasize on the need for us to be more thoughtful, conscientious, and robust when we talk about health investments, both particularly from the federal level, but also at the provincial levels, and to design programs and collaborations with communities, with civil society organizations, and other experts in order for us to be using the limited resources that we have judiciously and effectively.
Thank you so much, Madiha. Dr. Yasmin, if you can go next, please.
I think I already gave a lot of recommendation while I was talking, but I want to come back to the coordination and collective wisdom. So I think what we have learned from several layers, the things that have worked best when you have the right people sitting on across the table. And I would like to emphasize that the government cannot handle issue of this kind of a scale on its own. So a public-private partnership in a meaningful way, because we love to use this jargon more loosely than effectively. What does it mean when we say there is a partnership? And private sector doesn't always mean only the commercial. Of course, the NGOs and, like Madhi has said, community. I mean, people who have this conventional wisdom, especially when it is climate change, and how to reach out to these communities. So I think public-private partnership, involvement of the young people as youth leaders who can sensitize, who can really bring the change. Because we have to, I mean, 65% population in Pakistan are less than 30 years of age. And this is a huge demographic dividend that we can use, but we are not using. So I think involving them and engaging them to be the ambassadors, to be the kind of communicator about these issues, kind of change agents, and why these things are important and how everybody can contribute to it. And then, of course, I mean, a cross-cutting and a kind of a baseline issue about the accountability and the governance model. Unless we don't have overall that kind of an improvement, the health sector will remain very, kind of they will never deliver their optimum because of all these issues. So it has to be across the board, disaster, no disaster, what is coming, what is not coming. It has to be responsive to the needs, especially to the women and to the vulnerable communities.
Neha, if I can ask you to go next.
Thank you. So I would second some of what has already been said by Dr. Qazi and Madiha, which is one of them is that just recognizing how fragile our health system is and that it really cannot handle any kind of systemic shocks, not small ones, not big ones. So health system strengthening is still a really important thing for us to be thinking about right now, so that it can deal with just with shocks, but also with the inequalities and the health issues that are getting worse because of climate change. But then also, as Madiha said, just a broader understanding that climate is so, the kind of things that we're seeing are so intersectional, affects everything from heat to gender to early marriage to nutritional issues to really major health outcomes. So to understand that to address something so intersectional, you just need to address it at the root, but also kind of through a multi-sectoral response and things like early warning systems and preparedness at the community level are just also really important. Thank you.
Thank you, Neha. Ali Reza Sahab, if I can ask you to go next, please.
I think if I have to pick two things, the first would have to be allocation of more resources for health. And while allocating those resources, a much bigger percentage of that should go where it brings that investment brings the best results, the most results. That is immunization, nutrition, and antenatal and neonatal care. And secondly, improving governance in the health sector in all provinces. And that is easier said than done, I understand, and will require a concerted effort, and therefore would need leadership from the highest level of the executive in the province. Thank you.
Thank you. Sarah, if I may ask you to conclude, please.
Ji, thank you. I'll try not to repeat some of the things I've already said, but I just want to say in the end that as far as health resilience, health systems resilience to women's issues, especially reproductive health issues are concerned, it is a socio-technical problem. It's not a purely technical problem. It's not a particularly social problem. And there are other issues that need to be built into the conversation because it impacts women and climate change only exacerbates it. We need to be talking about meaningful partnerships. We need to not just partnerships, but meaningful partnerships, equal partnerships. We need to get into the issue of trade. We need to look into the issue of intellectual property. Our capacity to produce medicines is severely affected by regional agreements such as the TRIPS agreement. We also need to look at taxation issues. I do not understand why women's sanitary napkins are so heavily taxed in this country and inaccessible, although they are seldom used in rural parts of Pakistan, but still not accessible. And in the end, I just want to say that throwing money at the problem is good. I mean, throw money, but money has to be really thought out as to what you want to achieve, not in the next 2 years, 3 years, but possibly 10 to 15 years. We know there's a pattern happening. We need to be able to predict these things in order to make ourselves resilient. If we cannot predict what's coming and only grappling with in a reactive mode of what's happening right now, we won't get, I mean, we'll get somewhere, but again, there'll be another mile or few to go. So forward looking and more sort of, looking into the problem as it is emerging and leading to other more complicated problems that we can tackle at the local level quite easily to build resilience. Thank you.
Thank you so much, Sarah. I think that this was a deeply productive and very necessary conversation. A bit gloomy, as we discussed in the beginning, but necessary, very, very much so. So I'd just like to thank all of you for taking out the time to be here with us today, and to thank all of our audience for tuning in as well. As I said, we need to keep having these conversations, because that's the only way that we'll be able to actually construct a system that works, going forward, because there is really no other way to approach the scale of the quantum of the problems that we are dealing with at the moment. So thank you once again, all of you, for a really great panel, and thank you everybody for tuning in. This brings us to the end of this policy roundtable. Please do join us for the next one. Thank you, and Khuda Hafiz.